At all concerns, Assalamu alaikum. Welcome to my channel Pharmacology Made Easy. Today we'll discuss about the second session of routes of administration of the drug. Previous session we'll discuss about intravenous and intramuscular route and some important internal routes that are always discussed in professional examination. Now, one question is in variable time discussed in professional examination, and this question is why we choose different routes of administration of the drug, or why we choose different routes of drug. Why there is availability of different routes. What is the importance of different routes of drug? One is the important factor that is related with this question. One is physiochemical properties of the drug. As far we know that water soluble drugs are not given in orally. Only the lipid soluble drugs are given in orally. Example, insulins are not given in orally. It is used in subcutaneously, and in emergency condition insulin is given by intravenously. Insulin is a hormone, is a protein or polypeptide in nature, and when in given it orally, it is destroyed by proteolytic enzymes, so insulin cannot be given. Meanwhile, penicillin is one of the water soluble compound which cannot be given in orally because it is destroyed by the gastric hydrochloric acid. But in case of peptic ulcer disease, we can given antacid. Antacid is used in peptic ulcer disease. So the another important factors that is related with the routes of administration of the drug is site of action of the drug, a specific site of action of the drug. Example is 2 milligram of oral salbutamol is not effective than 200 microgram of inhalational route salbutamol. Or if we say that 200 microgram of inhalational route salbutamol is more effective and more viable than the 2 milligram of orally use of salbutamol, then we can another important factor is less adverse effect. If we give the if we choose the route of administration properly for a drug for any patient in suitable condition, that will give the drug more bioavailability. Salbutamol, if we give orally, it can produce for a prolonged period of time, it can produce the toxic effect, and that toxic effects are palpitation, tachycardia. If we give this salbutamol inhalationally, it will not produce any side effect, and it goes into the lungs and produce its natural effect, and that is bronchodilation in bronchial asthma. Another important factor is prolongation or the duration of effect of the drug. By choosing different kinds of or different routes of administration of the drug, we can prolongation or increase the duration of action of the drug. So these are the important factors for choosing different type of routes of administration of the drug. Now the parenteral route. In parenteral route, if we classified it, parenteral route are classified in intradermal route, intracardiac route, interarterial route, intravenous route, intramuscular route, subcutaneous route, and also interarticular route. And there are also some route that we given parenterally of drug, that is interpleural route, interperitoneal route, and intercardiac route. From this subcutaneous route is much more important, and the advantages of subcutaneous route is if we see in subcutaneous route, we give two types of drug. One is insulin and another is low molecular weight heparin that we use regularly. Insulin is given to control the blood sugar, and it is used in diabetes mellitus, and this low molecular weight heparin is used in deep vein thrombosis, in thromboembolic manifestation, in hypercoagulopathy, or we can use it in thromboprophylaxis or in thrombolysis of acute MI. This route is very much important to us, and its advantage is this route is used for slow, sustained, and uniform action of the drug. One is the important, one is the great advantage of this route is slow, sustained, and uniform action of the drug. And second is by choosing this route, we can avoid the fast pass metabolism. We can we can give a high dose of drug can be given, and this route and self administration is possible through this route. This disadvantage of this route is some drugs can cause using subcutaneously may cause lipodystrophy or lipodystrophy or lipohypertrophy. Lipodystrophy or lipohypertrophy, it means sometimes there is a lipid destruction of there and thinning of the skin, and absorption is variable and bioavailability will be raised, and sometimes there will be uh, invariable the absorption of the drug due to lipohypertrophy, where there is a lipogenesis and the subcutaneous fat may be increased, and this subcutaneous fat, the deposited drug, may be slowly released from there and may have sustained effect and may sometimes cause toxicity. This is one kind of disadvantage of using in this route, and sometimes also there is if we use drug in subcutaneously, it may be painful or it may produce abscess over there. Another important parenteral route uh, is interarterial route. In interarterial route, we can give several inotropic drugs. In intercardiac route, we use adrenaline for cardiac arrest patient. Sometimes intrapleural route, we give tetracycline to prevent the pleurodesis, and sometimes we use different kinds of dye interperitoneally to diagnose different kinds of disease over there. These are the important routes, parenteral routes, and now there is a miscellaneous route. And some routes are also important parenterally. In interarticular route, we give intravenous corticosteroid over there to prevent bursitis, tenosynovitis, and through interdermal route, we are tested for we give drug for to test for allergen, or test for some specific disease, or some allergic disease can be diagnosed to give allergen and see there is a reaction over there. So to diagnosis of some disease and to identify the special pathogen, we can use interdermal route. Now the topical route. Topical routes are subdivided in some types. Uh, mm, one is uh, one is eye administration, one is nasal administration. In eye allergic conjunctivitis, we give moxifloxacin eye drop. In case of nasal administration, in case of allergic rhinitis, we give xylometazoline, oxymetazoline. In case of nasal epistaxis, we give adrenaline over there. So these are the local administration of drug, and sometimes inhalational route is one kind of miscellaneous route. It is not topical route. In miscellaneous route, we subdivided it into topical route and inhalational route. Topical routes are application of drug into the eye, application of the drug into the ear, application of the drug into the nose, and also application of the drug into the vagina is one of the important route to topical administration drug. Example of topical administration of the drug. Now the inhalational route. Inhalational route is so much important in case of route of administration of the drug. We give different drugs inhalationally, and the advantage of inhalational route is it has a site specific action. It also rapid onset of action, and it's prevent the or it bypass the fast pass metabolism also. And sometimes the inhalational route uh, for prolongation of effect of the drug, we can give the drug also in inhalational route. By using or choosing inhalational route, or by using the drugs in inhalational route, we can also prevent, or we can also less the side effects of the drug which is used through systemically. The disadvantage of inhalational route, sometimes there will be irritation, and sometimes there will be irritation of the mucosa that causes cough, um, or any other. There is no discomfort by using of drug through inhalational route. The drugs which are used in inhalationally, or inhalation route, are salbutamol inhaler, salmeterol inhaler, fluticasone inhaler, beclomethasone inhaler, and there are much more. Some corticosteroid also be given in inhalational route. That is beclomethasone, fluticasone, mometasone are also given in inhaler route. So these are the drugs we can choose in inhalationally to prevent the bronchial asthma. Another drug nowadays we can give in inhalation route, but this drug is not available in Bangladesh. It is used in UK, and that is called the insulin, inhalational insulin. That's name is Afrizza. Afrizza is used in UK, and it is a good drug for controlling diabetes mellitus, but Afrizza may not be given in COPD and bronchial asthma patient, because it acts as an antigen, and there will be hypersensitivity reaction over there, and there may be bronchoconstriction. So students, you may not try to tell this Afrizza to your examiner in the professional examination. It's just for knowing to you the new drug, and this new inhalational insulin is used in UK, and its name is Afrizza. Okay. This is the importance of inhalational route. Another importance of inhalational route, that is through inhalational route we can produce the local and systemic effect of the drug. So two types of effects are produced in inhalation route. One is that is local effect over there, and local effect, and we can use if we use the corticosteroid through inhalation route, it gives the permissive effect and act on the bronchial mucosa to makes it bronchodilation. And another systemic effect, that is anti-inflammatory effect, also be produced through systemically. So inhalational route is an important route for choosing of drugs. So this all about the routes of administration of the drug. uh, Now we'll discuss about absorption of drug. What is absorption? Absorption is a process by which drug enters into the systemic circulation through any route of administration except intravenous and intraarterial route by passing through the biological membrane. The site of absorptions are alimentary tract. The mouth, the stomach, the small intestine, and rectum are the site of absorption of drug, and also skin and respiratory tract are also the important absorption site for drug absorption. And another important site is eye. Through eye the drug is also absorbed. So these are the site of absorption of the drug. Now what are the factors responsible for drug absorption? The factors are related with drug absorption are divided into two types. One is factors related to the patient, and factors related to the patient, and another is a factor related to the drug. If we discuss with the factors related to the drugs, these factors are physiochemical properties of the drug, lipid water partition coefficient of the drug, solubility of the drug, then molecular weight of the drug, then pK of the drug, and disintegration and dissolution of the drug. The lipid soluble particles are absorbed more, or water soluble particle absorb less, but also absorb through the pores of plasma membrane, and the lipid particles are absorbed intracellularly, and water soluble particles are absorbed extracellularly. And also, if we said lipid soluble particles are absorbed more and water soluble particles absorbed less. Okay, the molecular weight, if the drug is so much small, then it is absorbed easily, and the large molecular weight drugs are absorbed very slowly. Next one is solubility. We just complete the solubility. The lipid soluble drugs are more absorbed because our cell membrane are composed of lipid bilayer with protein, but this lipid bilayer helps the drug to absorb more through simple diffusion. Okay. Next, disintegration and dissolution drug. The drug which becomes disintegrated mode and dissoluted mode, that will be absorbed less, and which dissociate after the drug is absorbed from the intestine. This drug's bioavailability is more. So these are the important factors related to the drug that helps in absorption. Now we will discuss about the factors related to the patient. Factors related to the patient. At first, factor related with gut is very much important. One of the first factor which is very much important, that is pH of the gut. pH of the gut. Acidic drug in acidic media, less ionization, and that will be more lipid soluble and more absorption. Acidic drug in basic media, more ionization, less lipid soluble, that is less absorbed. A basic drug in basic media, that is less ionization, more lipid soluble and more absorption. And basic drug in acidic media, that is less ionization and less absorption. The second thing is vascularity of the surface area. Small intestine vascularity is more than the stomach, so maximum drugs are absorbed from the small intestine. Upper part is small intestine is more responsible for drug absorption, and it is the most important site for absorption of the drug. Next, surface area. The small intestinal surface area is more than the stomach surface area, because the small intestine is composed of mucosal fold. In the mucosal fold, that is epithelial cell. This epithelial cell has composed of several folds, that is called folds of Kerkine. The total surface area of the small intestine is 200. It is 280 centimeter long, and it is 4 centimeter in diameter. And these folds of Kerkine is surface area is 200 meter square, and this increase the surface area of the stomach is sixfold. And there is presence of villi and microvilli over there. Villi are the small projection over the mucosal fold, and this presence of villi makes the surface area more than tenfold than the stomach. And another thing is microvilli. Microvilli also have the surface area of more than 1 lakh square meter. The villi makes the surface area of the small intestine is equal to 1 lakh square meter. So that's why the small intestine is more surface area for the drug, for more absorption. The stomach also, some drugs are also absorbed in the stomach, but stomach consists of, if we see the inner mucosal layer, it is composed of a mucous layer and lamina propria and then muscle layer. These mucous layer have some folds and some gastric pit over there, and that helps in and gastric fold, and this helps in drug absorption. And there is also drug absorption in the lamina propria, which is presence of connective tissue, lymphatics and blood vessel, where the drug can be absorbed. And there is a key muscle layer. This mucosal layer of the stomach also responsible for drug absorption, but maximum drug are absorbed into the small intestine. It is very much important. Next thing is gastric emptying time. Gastric emptying time, sometimes it is the time required for the for the drugs or for the substance or for the food to comes easily from the stomach to the intestine. When the drug or the food come more to the small intestine, this drug will be more absorbed. If the gastric emptying time will be increased due to use of metoclopramide or domperidone, the drug will be more, this drug will be more absorbed. Fatty food increases the drug absorption also. This is the gastric emptying time is also the important factor for drug absorption. This gastric emptying time is decreased by using of uh, cholinergic antagonist drugs such as atropine. Atropine decreases the gastric emptying time. That's why it decreases the drug absorption. And the metoclopramide it increases the gastric emptying time, and it may increase the drug absorption also. Another important thing is bowel transit time, and it is the time required to come the food stuff into the rectum. So it is indirectly it is inversely proportional to the drug absorption. The more the bowel transit time, the less will be drug remaining in the intestine, and there will be less absorption of the drug. If we say there will be increased motility of the gut due to any disease or due to any drug, if we, and it becomes increased due to increase the motility of the gut, this motility makes the drug less time presence in this in the intestine, and it will be less absorbed. If we say diarrhea, it's where there is a increased intestinal motility, that there will be less absorbed in diarrhea. So that's why we have to give more drugs in diarrhea for absorption of the drug. In case of some gastrointestinal disease also responsible for making the drug hasten the drug absorption. Some disease such as Crohn's disease, ulcerative colitis, where there is a slough out of the intestine, or there may be ulcer over there. This causes increase the drug absorption. But some disease which may cause diarrhea, which may cause cholera, which may cause IBS, makes the drug less absorbed from the small intestine. These are the important patient-related factor that is responsible for drug absorption. So thank you very much. Next, we'll discuss about the transport system of the drug, how a drug is transported into our cell membrane, and also the bioavailability, which is an important parameter of drug absorption. Thank you.